pledge will be led by the gentlewoman from Texas, Ms. Johnson.
I'm here this morning just to address education. How do we know? Because the people have told us so. We represent the ideal way to alleviate the shortages is by ensuring that children of all races and both genders receive the basic grounding in science and mathematics that will prepare them to pursue careers as scientists, engineers, and technologists. Is it not time, then, for America to grow morally? For those who fear to answer this question, I will answer it for them. The time is now.
Now more than ever, what happens in Washington impacts us here in the Dallas-Fort Worth area. Your Congresswoman, Bernice Johnson, will help you understand what goes on inside the federal government and share perspectives from today's leading policymakers and opinion leaders. And now, your Congresswoman, Bernice Johnson.
Hello and welcome to the Capitol Report. My guest today is Robin Rudowitz, the principal policy analyst for the Kaiser Commission on Medicaid and the Uninsured, an initiative of the Kaiser Family Foundation. The Kaiser Family Foundation is a nonprofit, nonpartisan foundation that provides facts and analysis for policymakers, the media, healthcare providers, and the public. So today we will be discussing how the recession has impacted healthcare across the United States. She has worked in healthcare policy in both the public and private sectors for many years, and she received both her bachelor's degree and her master's degree in public administration at Cornell University. Welcome to the show.
Thanks for having me.
Tell me a bit about what you do on a daily basis.
Well, the Kaiser Family Foundation does do research and policy analysis, and I focus on Medicaid issues and Medicaid financing issues as it affects low-income individuals and the states.
And we've been talking a lot about health care reform and public option meaning to try to include all the people that are not insured now, that for some reason or the other cannot either afford insurance or get insurance, or don't know how to go about it, or can't be insured by the insurance companies now for health care. That includes a lot of the category of which you are studying. So tell me a bit about how that relates to the health care reform debate.
Well, there's obviously a lot of debate going on in Washington about health care reform, and while there are some differences in the proposals that are out there, one common piece of many of the proposals is really a Medicaid expansion. So this would expand the current Medicaid program to reach more low-income individuals, and it would essentially set a floor, or national minimum, at about 133% of the federal poverty level, so that's about $30,000 for a family. And then on top of that, you would get into some subsidies for low-income people who can't afford to purchase private coverage, and those are the people who would be eligible to participate in what you're talking about, this exchange. And of course, one of the key debates is whether there would be a public option in this marketplace or in this exchange or not. But really the Medicaid piece is really the piece that would affect many low-income individuals by expanding that program to have a broader reach across the states.
To have that program expanded, how would it affect people that go to emergency rooms and have no money, the uncompensated care?
Well, essentially, expanding coverage would hopefully reduce the need to go to the emergency room, because many times people wind up in the emergency room because they don't have insurance coverage, so they can't afford or they don't have access to go to a doctor. We find that individuals with Medicaid compared to those without insurance are much more likely to have a usual source of care. They're much more likely to get the care that they need, and they're much more likely for kids in particular to have a doctor's visit, a dentist visit, et cetera, whereas you see the statistics for people without insurance are much, much higher. So again, without access to a regular doctor, people are much more likely to let their conditions get much worse, delay care or not get the care that they need, not fill the prescriptions that they need, and then conditions get worse and they wind up in the emergency room. But having coverage hopefully will address a lot of that need and hopefully will reduce the level of uncompensated care that hospitals are seeing.
Do you have any idea what percentage of that population would be in that category and what would be left out?
Well, you know, these reforms that they're talking about in Congress would likely cover, you know, 95 to 90%, 97% of the people who don't have health insurance right now. We know that on a national basis, they're expecting an increase of 11 million more people by 2019 in the Medicaid program. So most people without insurance would have access either to the Medicaid program. They might wind up participating because there'll be an individual mandate in their employer-sponsored coverage, or they might find that health care is more affordable now if they can get a subsidy to help them purchase health care. So these reforms that are being debated in Congress are likely to affect a great many of the uninsured, and there are about 46 million people without insurance in the country right now.
And there are a number of people that have been affected by being laid off during the recession. When their eligibility is calculated, are they calculated from what they were making, or are they calculated for not having any income at the time?
Right. Well, your subsidy and your eligibility for Medicaid is based on your, you know, your current income. How that works. Of course, these health reform initiatives would not go into effect until 2013, and we know that there are many people and many families struggling right now with the recession. So that these reforms don't provide immediate assistance to these families who are currently affected by the recession. But we know that families right now are really struggling because they lost their job, and often their health insurance is tied to their job, so they've lost their job-based coverage, and many of them are now uninsured, which means that they're, you know, in that uninsured bucket, going without the care that they need, and in real financial risk, because if they do get sick, they could have really extensive medical debt. So one thing that has been very effective for the people who are currently hit by the recession, particularly for kids, has been the Medicaid program. Because most states, 43 states and the District of Columbia now in their Medicaid programs cover kids who are at or above 200% of the federal poverty level. So that's families with $40,000 or so. So kids are, you know, there's a safety net there. So kids can get access through these public programs, but their parents, the eligibility levels are much lower, and adults without dependent children, there's very, very few options for them right now. So while health reform does hold the promise to help many more people, those reforms are not you know, helping these families that are struggling right now.
Is the unemployment money that might be coming in to someone who is unemployed count toward income?
It does, and in fact what we're seeing is that often a family might go to apply for Medicaid. So again, they've lost their job and their job-based coverage. They'll go to apply for Medicaid, and sometimes they find that their unemployment benefit will put them over the income limits to be eligible for Medicaid. I think as these unemployment benefits start to run out, then individuals, you know, don't have that income and become eligible. But it has been one of the barriers in gaining access to the Medicaid program, because those are counted as income.
Will hospital facilities be able to get reimbursed by Medicaid when they have so much uncompensated care rendered?